Na kwingineko, muungano wa maafisa wa kliniki hapa nchini KUKO na maafisa wa maabara wanaandamana hapa jijini Nairobi wakidai kutolipwa mishahara kwa miezi 16 na serikali kushindwa kuwajumuisha katika huduma ya kudumu ya pensheni kufuatia kusitishwa kwa kandarasi yao na Global Trust Fund mnamo mwaka 2023. Hebu tuvuke mubashara tuweze kuona yanayojiri hivi sasa.
15 years, 16 years, we have clinic officers and laboratory officers. About 16 years ago, when Kenya was really suffering from the HIV pandemic, together with other diseases, and especially one of the opportunistic diseases that has been killing Kenyans is TB, the Global Fund came in to capacity build the Kenyan government so that we can be able to mitigate the scourge of HIV. The officers you see here today are the officers who are engaged by the Global Fund in collaboration with the Ministry of Health. And that was before devolution. When they were engaged, they were sent to different hospitals across the different counties in this country. And they have diligently been offering their services for 16 years. And we can attribute the successes that we have in HIV and TB management to this group, because they have been running these clinics. But the unfortunate thing is that though when the Global Fund was coming in, they actually took care of the transition of these officers. And they made sure they had an agreement with the government through the Ministry of Treasury and the Ministry of Health that after the exit of Global Fund, the government was supposed to absorb these health workers. The agreements are there, the documents are there, we are going to share with you. But after that happened, which was now during devolution, I think that started from around 2022. Then, those who are under the Ministry of Health here, they were absorbed. But those ones who are under the counties, about 91 of them, I think 25 clinical officers and about 76 laboratory workers were left out. These people have been working for the last 16 months without pay. They have suffered immensely. They have suffered mental health challenges. And we must remind them that the lady by the name Gladys Rimui, a clinical officer who went into depression and ultimately took her life and that of her child from Nyeri in April last year, that loss is upon this ministry, upon the treasury, and upon the government. The people you see here, they cannot even afford the schools they wanted for their kids. Some of their children have had to stay at home because they cannot be able to pay. For 16 years, they diligently worked for this country. And the repayment they have had is 16 months of enduring poverty, starvation, watching your kids suffer, and that is why they are here today. They are supposed to be 91, but the reason as to why you can say it's not as a big group as you would expect is because they cannot even afford the fare to come here, because they are across the country. And so today, we are marching to Parliament to ask Parliament, because we have done numerous petitions to this ministry, to the Treasury, to the PSA, to ask them what they are doing, because they are mandated by the Constitution to ensure that there is fair administrative action. And especially for a case where the government had committed to ensure that they are absorbed. This is pure negligence, and that is what, as Kenya Union of Clinical Officers and as Kenya National Union of Medical Laboratory Officers, we are coming out to condemn.
Naam, hao ni maafisa wa maabara pamoja na wasimamizi wa kliniki ambao wameendelea na mgomo wao na hivi sasa wanamalizia hapo, waendelee na maandamano hadi katika majengo ya bunge na kufuatia agizo